Dr. Kenneth Blum is considered by his peers to be the world's leading authority on the DRD2 gene, the most studied gene in the psychiatric genetic field. The DRD2 is also known as the reward gene. It controls our impulsive, compulsive, and addictive behaviors. Dr. Blum has dedicated his life to understanding the scope and the impact of the reward gene, while developing a safe and natural nutraceutical to help those stricken with reward deficiency syndrome. Due in part to Dr. Blum's seminal discoveries, it is now well established that in both food and drug-addicted individuals, there is dopamine resistance due to an association with the DRD2 gene A1 allele. Based on the most current information available, it is estimated that 1 in 3 Americans carry the DRD2 gene A1 allele genetic expression. People with this genetic expression who are drugging, drinking, smoking, experiencing unusual sexual habits, and displaying other addictive behaviors do so to achieve a sense of well-being and normalcy. However, evidence is now emerging whereby the potential of utilizing a natural, non-addicting, safe, putative D2 agonist may find its place in recovery from reward deficiency syndrome in patients addicted to psychoactive chemicals. Reward deficiency syndrome, or RDS, is a condition characterized by the lack of reward or pleasure a person derives from everyday experiences. For Part 1 of this pilot study, Dr. Blum drew 2 subjects, an alcoholic and a heroin abuser, from the pool of hundreds studied. Both patients had the DRD2A1 allele, suggesting a genetic antecedent associated with a high risk for drug-craving behavior, or RDS. Dr. Blum reports that QEEGs of the subjects, who had existing abnormalities of widespread theta and alpha activity during protracted abstinence, were significantly normalized by the administration of 1 intravenous dose of a patented neuroaptogen amino acid therapy complex variant KB220. The neuroadaptogen amino acid therapy, or NAT, increased alpha band with a concomitant increase in low beta activity in the brain of an alcoholic undergoing protracted abstinence. The orbital frontal and cingulate gyrus is the loci of the effect. Based on our QEEG studies presented herein, we cautiously suggest that long-term activation of dopaminergic receptors, more specifically the DRD2 receptors, by the KB220 IV variant, will proliferate D2 receptors, leading to enhanced dopamine sensitivity and an increased sense of happiness. For the second part of this study, Dr. Blum enlisted the help of his close friend and colleague, alternative medicine pioneer John Giordano, founder and president of G&G Holistic Addiction Treatment Center in North Miami Beach, Florida. Together, they conducted a triple-blinded 2x2 crossover placebo-controlled study over several weeks on 14 volunteers. These subjects were diagnosed as having severe psychostimulant dependence and have been in recovery for 2 years or more. The patients did not have any psychoactive drug and/or amino acid therapy for 6 months or more prior to testing. Each patient consumed the patented neuroaptogen amino acid therapy complex KB220Z or a placebo in the morning before breakfast and 1 hour prior to scanning. After 7 days, the experimental and placebo groups were switched, and QEEG tests were repeated on each patient. For the second experiment, 4 polydrug abusers were selected, all of whom were undergoing protracted abstinence and carrying the DRD2A1 allele. The same 2x2 design used for the first experiment was used in the second. The QEEG results shows the graphical representations of group mean differences before and after intervention, whereby Group 1 was administered neuroadaptogen amino acid therapy and Group 2 was administered placebo. A comparison of the FFT absolute power measured in microvolts of alpha between 8 and 12 Hz demonstrated higher activity in the neuroadaptogen amino acid therapy group compared with the placebo group. Similarly, observing the FFT absolute power of low beta between 12 and 15 Hz shows that the activity is considerably larger in the neuroadaptogen amino acid therapy group compared with the placebo group. While analyzing the absolute power differences between groups, it was discovered that there was an increase in alpha activity, a difference of 25 microvolts between groups in the parietal regions. This increase was further isolated to be most prominent in the alpha-2 10 to 12 Hz and beta-1 12 to 15 Hz bands. Finally, there was a consistent effect of KB220Z on frontal regions when compared with placebo. The p-values for Group 1 versus Group 2 for a between-group analysis of Week 1 and Week 2, whereby group comparisons utilizing t-tests were performed. The FFT power ratio independent t-test results were significant at the 0.03 level in both analyses, in spite of a small sample size. After extensive analysis, it was found that there was an increase in amplitude of all frequencies across all 19 channels recorded. KB220 amino acid complex regulated the dysregulated electrical activity sites over the posterior cingulate gyrus, which links directly to cravings. A closer examination of the alpha and beta properties revealed a generalized switch in asymmetry across all sites, and most pronounced in areas commonly associated with impulsivity, anxiety, compulsion, and cravings. Although the exact mechanism of action remains elusive, preliminary fMRI data suggests that KB220Z significantly activates dopaminergic pathways. Moreover, the coupling of gene testing along with a safe, non-addicting neuroadaptogen amino acid therapy that upregulates instead of downregulates dopaminergic receptors, preferably the D2 subtype, could soon play a significant role in the recovery process of people suffering from the acute and painful effects of RDS. For the text version of this report, please visit postgradmed.com. And also visit rdsyndrome.com for a complete overview of Dr. Blum's natural solution to addiction. For addiction information, please visit www.holisticdrugrehab.com.